You're welcome again. This is your friend, Nurse Pollution. Let's talk about the risk of HIV transmission from a woman's menstrual blood. Is it low? Though it's low, it might be low, but it's not zero. If the woman has an undetectable viral load due to effective HIV treatment, the risk is negligible. It might not, it might be inconsequential. However, if the woman has a detectable viral load, the risk increases, especially if there are open sores or cuts on the skin of the person exposed to the menstrual blood. You understand? And most of the time when we talk about HIV, it's through, sexual intercourse, blood, semen and all that. What are the factors influencing the risk? Viral load, the most crucial factor is whether the HIV positive woman has an undetectable viral load due to antiretroviral therapy. If the viral load is undetectable, the risk is considered minor, even during menstruation. And of course, the menstrual blood quantity is taken into play. A larger amount of menstrual blood increases the risk of transmission, particularly if it comes into contact with broken skin, that maybe the man has a sore or an open wound or injury on the male genitals. Then if there are open sores or cuts, if the person exposed to menstrual blood has open sore, cuts, or other breaks in the skin, apart from the genital, the risk of HIV transmission from the partner is highly possible. What about the mucous membrane? HIV can be transmitted through mucous membrane, like those in the mouth, the vagina, or the rectum, but not through intact skin that has no cut, no sore, no abrasion, no bruises or something. Then other sexually transmitted infection, having other sexually transmitted infection like gonorrhea, chlamydia, can increase the risk of HIV transmission. So let's talk about the specific scenario when we're talking about interskin. If menstruation blood comes into contact with interskin, there is no risk of HIV transmission, right? But if there are open sores and cuts, and the menstrual blood come into direct contact with open sores, cuts, or the breaks in the skin, the risk is high, especially if the woman has detectable viral load. Do you understand? What about oral sex? If a woman with a detectable viral load engages in oral sex during her period, the risk to a partner is higher, especially if the partner has any sore or cut in their mouth. Do you understand? So, and of course, if the woman has an undetectable viral load due to the treatment, the ongoing treatment, the risk of transmission is effectively zero, regardless of the scenario. Important consideration when it comes to having sexual intercourse, unprotected sexual intercourse with somebody with HIV or during menstruation. Well, there are pre-exposure prophylaxis medications are there, and they are used to protect against HIV infection if they come into contact with infected blood. It can be health workers, we use that if there is a needle prick or accidental something. So you have to consult your doctor for personalized advice and risk assessment. It is also better to consult a healthcare professional if you know you are going through all these things. Remember, health is wealth, and see you in the next video.